23 बच्चे आ गए हैं। अच्छा मेरी बात सुनो, इधर घड़ी तो इधर लगा दो, मुझे टाइम नहीं पता चल आ जाएगी इधर। बेटा 8:05 पे मुझे बता। नहीं नहीं, 8:30, अभी 8:30 है ना, 8:35 पे बताना, मैं उस वक्त स्टार्ट करूंगी जब बच्चे तो आए ना। मेरा सॉरी, मुझे ना थोड़ा सा वो 8 बजे लगा था। बेटा वो पीछे से ना जरा पंखा तो एक चला दो, ये वाला नहीं, पीछे वाला चला दो। अस्सलाम वालेकुम, फोर्थ ईयर। We were studying the topic of ovarian tumors, and students, I want to tell you one thing. Please be serious. And अभी 8:35 हो गए हैं, आप लोगों का 8:30 का टाइम है, and there are only 41 participants as yet. I waited 5 minutes के कुछ तो 104 या 105 की क्लास में से कुछ तो कैंडिडेट्स ज़्यादा हों, लेकिन ये तो बहुत बुरी बात है, आप लोगों का एग्जाम सर के ऊपर है एंड यू पीपल आर स्टिल नॉट सीरियस। अच्छा, वी वर स्टडिंग द ओवेरियन ट्यूमर्स। ये अब आप लोगों की अपनी मर्जी है, मैंने अब लेक्चर स्टार्ट कर दिया। We were studying the ovarian tumors, and we finished the major category of ovarian epithelial tumors. And yesterday we started with the second major category, that is the germ cell tumors. And the germ cell tumors में से हमने yesterday we finished with the teratomas. The most common of the germ cell tumors are the teratomas. And to recapitulate what we did last time, the germ cell tumors. The germ cell tumors are divided into three categories. Sorry, the constituents of the germ cell tumors, usme sabse common the teratomas. And the teratomas were again divided into three categories: the mature teratomas, the immature teratomas, which are the malignant teratomas, and then we have the specialized or the monodermal teratomas. अब जर्म सेल की कैटेगरी में हमारे पास आ जाते हैं टेराटोमास आ जाते हैं. इसके अलावा वी हैव द डिसजर्मिनोमास, द एम्ब्रियोनल कार्सिनोमा, द योक सैक ट्यूमर एंड कोरियोकार्सिनोमास. इसके अलावा germ cell tumors में एक और कैटेगरी है which are the mixed germ cell tumors in which all components of these different germ cells they are mixed together. Now teratomas are basically those germ cell tumors which are seen predominantly in the younger age group. And we have finished these three categories. ये मैं सिर्फ आप लोगों को रिवाइज करा रही थी. अभी तक only 44 participants. Mature teratoma. बात सुनो एक मिनट. ये जो चैट्स है ये 99 है. ये कौन है? पार्टिसिपेंट्स 45 हैं, चैट्स 99 है. इसका क्या मतलब? ये अभी जो मैंने पहले किया है वो नहीं इनको आवाज है. अब मुझे ठीक. प्रेस एस्केप. ये हमने कल सारा कुछ कर लिया था. मैंने अब सिर्फ थोड़ा सा रिवाइज कर रही थी. Dermoid cysts हैं which are predominantly composed up of the ectodermal components like skin. ये सारा हमने कल पढ़ लिया था. टेराटोमा आपको पता है they are tumors which are derived from more than one germ layer. They are derived from all the components of the ectoderm, the mesoderm and the endoderm. Predominantly जो dermoid cyst में ectodermal components होते हैं. ये तस्वीर भी आप लोगों को दिखाई थी. This is basically a ball of hair. This is a cystic teratoma containing a ball of hair. ये भी कल तस्वीर दिखाई थी. This is a teratoma containing hair and cheesy sebaceous material. A teratoma containing hair structures, and on the left side of the field we have brain tissue. This is a teratoma predominantly showing skin and its components, epidermis and the dermal components. ये सारे sebaceous glands. मोनोडर्मल और स्पेशलाइज्ड टेराटोमा ये आप लोगों ने बहुत अच्छी तरह याद रखना है because these usually come in the MCQs. Struma ovarii क्या होता है? This is based, the word struma means thyroid. Struma ovarii is the presence of thyroid tissue in a teratoma, predominantly composed up of thyroid tissue in a teratoma. And if that thyroid tissue functions, it can lead to hyperthyroidism. Number two is an ovarian carcinoid tumor, and the ovarian carcinoid tumor arises from the intestinal tissue because a teratoma can contain everything. It can contain intestinal tissue, it can contain bronchial tissue, it can contain brain tissue. So the intestinal tissue which is present in an ovarian carcinoid tumor is the origin of the carcinoid tumor. And these tumors, they can produce the carcinoid syndrome. Then stromal carcinoid is a combination of struma ovarii and carcinoid in the same ovary. यानी कि इसमें thyroid tissue भी है और इसमें कार्सिनॉइड ट्यूमर भी. So the immature teratoma is a malignant teratoma, and it is basically it contains immature neuroepithelium. This is the mature neuroepithelium. Now we come on to the second major category, and the second major category of the germ cell tumors is the dysgerminoma, and जो इसका counterpart which is seen in the testes is known as a seminoma. ये भी आप लोगों को पता होना चाहिए because MCQs में ये वाला component पूछा जा सकता है कि the ovarian counterpart of the testicular seminoma is the dysgerminoma, or the testicular counterpart of the ovarian dysgerminoma is the testicular seminoma. And these tumors, they also arise in the younger age group. आपने याद रखना है जितने भी germ cell tumors हैं, they arise more or less in a younger age category, and they usually arise in those gonads which are abnormal gonads. And most of these dysgerminomas, they do not have any endocrine function, and the diagnostic markers are OCT3, OCT4, NANOG, and CKIT. And these four markers, that is OCT3, 4, and NANOG, they are transcription factors which are involved in pluripotency of the germ cells. So dysgerminoma grossly, they are unilateral tumors predominantly, and their size ranges from small nodules to large masses filling the whole of the abdominal cavity. Cut surface, usually the dysgerminomas, बाकी जो हमारे surface epithelial tumors थे, and the teratomas, they can be a combination of solid and cystic component, but a dysgerminoma is predominantly solid, yellow white to gray white, soft and fleshy. On microscopic examination, a dysgerminoma is composed of large polygonal cells, polygonal or polyhedral cells, large cells having a clear cytoplasm and well defined cell boundaries. The cells are clear because of the presence of glycogen. And these cells, इनके अंदर जो nucleus होता है, it is a centrally placed large nucleus with very prominent large nucleoli. सेल भी बड़ा है, साइटोप्लाज्म क्लियर है, न्यूक्लियस बड़ा है, और न्यूक्लियस के अंदर जो न्यूक्लियोलाई हैं वो भी बहुत prominent है. And these cells are arranged in the form of groups and clusters or sheets, and these sheets are intercepted by bands, fibrous bands, and those bands, they contain mature lymphocytes and plasma cells. There is an abundant plasmacytic infiltrate in the bands, the fibrous bands which separate these nests of dysgerminoma cells. इसके अलावा dysgerminoma के अंदर you can also find the presence of granulomas. So this is a figure showing these are the large polygonal cells. These are the large polygonal cells with clear cytoplasm. Centrally placed nucleus, और nucleus के अंदर आप देखो कि बहुत बड़ा prominent nucleolus है. इस cell की तरफ देखो. This is a large cell with clear cytoplasm, centrally placed nucleus with a prominent nucleolus. These are the fibrous bands which are punctuated by a lymphocytic infiltrate. ये इसके diagnostic features. Dysgerminoma, all dysgerminomas are malignant, but the aggressive component, but those that behave aggressively amount to only 1/3. हैं ये malignant, लेकिन बहुत ज़्यादा aggressive नहीं होते, only 1/3 are aggressive. And regarding their treatment, those tumors which are confined to the ovary, a simple salpingo-oophorectomy, that is, salpingo is tube and oophorectomy is ovary. A simple removal of the fallopian tube and the ovary is going to be curative, and there is going to be an excellent prognosis, 96% cure rate. And remember that जितने भी ये जो germ cell tumors, जो malignant germ cell tumors हैं, they respond to chemotherapy. All of them. All the malignant germ cell tumors, they respond to chemotherapy. The second major tumor in the germ cell category, हमने germ cell tumors, देखो हमारे ovarian tumors हमने 5 में डिवाइड किए थे. Epithelial जिनमें serous, mucinous, clear cell, endometrioid, transitional जिसमें Brenner सारे आ गए थे. ठीक है, clear cell, endometrioid वो है. Second major category is the germ cell category. Germ cell category में हमारे पास आ जाते हैं teratomas, mature, immature, and the monodermal or the specialized. Third category आ रही है yolk sac tumor. अब जो yolk sac tumor है, this usually occurs in children and it is also known as an endodermal sinus tumor. अब आपने एक चीज याद रखनी है कि ये जितने भी हम ट्यूमर्स कर रहे हैं, with the exception of the surface epithelial tumors, जो germ cell tumors हैं और जो sex cord stromal tumors, the third category, ये सारे male testes में भी occur करते हैं. They also occur in the testes. So yolk sac tumor, फीमेल में जो yolk sac tumor है, मेल में भी है. Dysgerminoma, फीमेल ovary में भी है, उसका counterpart is seminoma, which is occurring in the testes. So the yolk sac tumor का दूसरा नाम है endodermal sinus tumor, and it is a malignant tumor of germ cell origin, and it is derived from the malignant germ cells which are present in the which differentiate along the extra embryonic yolk sac lineage. And most of the population which is affected are children and young females. या आमतौर पे 4-5 साल के बच्चों में होता है. And these tumors, they elaborate alpha fetoprotein. Alpha fetoprotein is a tumor marker, and it is alpha fetoprotein is a tumor marker. Not only is it seen in a yolk sac tumor, और कौन से ट्यूमर में अल्फा फीटोप्रोटीन आपको मिलेगा? ये आप लोगों ने पढ़ा हुआ है, कौन बताएगा? फातिमा, फातिमा, अल्फा फीटोप्रोटीन और कौन से ट्यूमर में डिटेक्ट होगा?
मैम लिवर कार्सिनोमा.
किसमें?
लिवर कार्सिनोमा.
शाबाश, वेरी गुड. इन हेपेटोसेल्युलर कार्सिनोमा. शाबाश, वेरी गुड. सो दूसरा ट्यूमर है yolk sac ट्यूमर. इसके अलावा ट्यूमर्स के अलावा भी it can be expressed in certain other conditions like ये जो हमारे होते हैं sacrococcygeal teratomas में भी एक्सप्रेस होता है, and certain conditions in which it is associated with fetal death, intrauterine fetal death भी हो तो alpha fetoprotein elevate हो जाता है. So two tumors आपने याद रखना है, hepatocellular carcinoma and yolk sac. Morphology, the classic feature which is present in a yolk sac tumor, एक तो इसमें it produces very high levels of alpha fetoprotein, which is a tumor marker. ठीक है. Number 2, histology पे the characteristic key feature which you can appreciate is the Schiller-Duval body. Now the Schiller-Duval body is a type of a primitive glomerulus. It contains a central blood vessel and it is surrounded by tumor cells, and those tumor cells lie within an empty space, and that empty space is also lined by these cells. So the glomerulus-like structure is known as the Schiller-Duval body. ठीक है? And number 2 जो histology में इस in tumors में नजर आ जाता है, you find prominent pink rounded eosinophilic globules, and those eosinophilic globules, they contain alpha 1 antitrypsin, and these eosinophilic globules, they also contain alpha fetoprotein. So alpha fetoprotein serum में भी detect हो जाता है, and it can also be detected in the tissue on special immunohistochemical stain. So tumor markers में alpha fetoprotein is very important in order to detect this tumor. इसके अलावा the role of alpha fetoprotein not only in diagnosis, but it also plays a role in the response or the prognosis of the tumor. If the yolk sac tumor is removed, the alpha fetoprotein, technically the alpha fetoprotein level, it should fall to baseline levels. Lekin if the alpha fetoprotein level, it rises post surgery or post chemo, so it means that the tumor has not been completely eradicated, it has not been removed, or number two, it has recurred. Rising alpha fetoprotein levels indicate recurrence or relapse of the tumor. So this is a figure showing a Schiller-Duval body. This is the central fibrovascular core, and these are the surrounding germ cells, malignant germ cells which surround it. This is the characteristic Schiller-Duval body, which is the hallmark of yolk sac tumor. Yolk sac tumor is a tumor which comes in the category of germ cells. Clinical presentation, it presents in children and females in their teenage years, and obviously like all ovarian tumors, this is also going to present as abdominal pain and a rapidly growing mass. All germ cell tumors, I told you that they respond to chemotherapy, and this tumor after chemotherapy, it is associated with an 80% survival independent of the disease stage. The fourth germ cell tumor is the choriocarcinoma. Now, the choriocarcinoma, pure choriocarcinoma, जिस वक्त हमने gestational trophoblastic diseases की थी, उसमें हमने classify किया था choriocarcinoma को into two types. The gestational choriocarcinoma and the extra gestational choriocarcinoma. Gestational choriocarcinoma is a tumor of the placental tissue. It is a malignant tumor of the placental tissue, whereas the extra gestational choriocarcinoma is seen in the ovary. Pure choriocarcinomas are very rare. They usually occur in combination with other germ cell tumors. Histologically, they are identical to the more common placental lesions, that is the trophoblastic tumors, जो placenta में होता है, that which is known as the gestational. अब इन दोनों में ये फर्क है, जो gestational choriocarcinoma है, that responds to chemotherapy. It literally melts away. पूरा का पूरा बिल्कुल मेल्ट कर जाता है. इनफैक्ट कोई भी उसका ट्रेस नहीं रहता कि it is there was a tumor or not. It responds so well to chemotherapy. इस वजह से जो gestational choriocarcinoma हुआ है, उनको हम miracle tumors या magic tumors भी कहते हैं, because magic malignant tumors or miracle tumors, because they literally disappear after choriocarcinoma. Lekin the choriocarcinoma which occurs in the ovary, it carries a very bad prognosis because it does not respond to chemotherapy. And the ovarian tumors, they are very aggressive and they have usually metastasized via the bloodstream to the lungs, liver, and bone by the time the case is diagnosed. High levels of chorionic gonadotrophin are helpful in diagnosing a choriocarcinoma. And a choriocarcinoma, we have just discussed this point that a choriocarcinoma arising in a placental tissue, which is known as a gestational choriocarcinoma, is very sensitive to chemotherapy. But an ovarian choriocarcinoma, that is an extra gestational choriocarcinoma, does not respond to chemotherapy and it is invariably fatal. Other germ cell tumors, अब हमने teratomas कर लिए, हमने dysgerminoma कर लिए हैं, हमने yolk sac tumor कर लिया है, हमने choriocarcinoma कर लिया. Fifth is embryonal carcinoma, sixth is a polyembryoma, and seventh category is the mixed germ cell tumors. अब इनमें short ऐसे question इस तरह आ सकता है कि ovarian tumors की classification तो मैंने आपको कहा था कि बहुत important है. एक अब सब क्लासिफिकेशन भी एग्जाम में एज अ शॉर्ट ऐसे क्वेश्चन आ सकती है कि नेम द germ cell tumors of the ovary. and describe the morphological features of teratomas or the morphological features of the dysgerminoma or the morphological features of yolk sac tumor. तो ये 7 मेन आपके germ cell tumors, ठीक है. Teratomas, उनकी भी आगे से क्लासेस हैं, mature, immature and malignant teratomas, and the monodermal or the specialized teratoma. Second are the dysgerminomas. Third are the yolk sac tumors. Fourth are the choriocarcinomas. Fifth are the embryonal carcinomas, then polyembryomas, and then we have the mixed germ cell tumors, in which there is sare ke sare tumors like the germinomas, dysgerminomas, the teratomas, the yolk sac tumor, and the choriocarcinomas. They occur in combinations. Now we come on to the third major category, and that is the sex cord stromal tumors. Now the sex cord stromal tumors of the ovary, they are derived from the ovarian stroma. And the ovarian stroma is in turn derived from the sex cords of the embryonic gonad. हमने ovarian tumors को classify किया था, those which arise from the surface epithelium of the ovary, those which arise from the germ cells of the ovary. Third is the category of those which arise from the stroma of the ovary. And now these stromal tumors or the sex cord ovarian tumors, these are those tumors which usually they elaborate hormones. They may either elaborate the feminizing hormones like estrogen, or they may elaborate the masculinizing hormones like the androgens, that is testosterone. Now the primitive ovarian stroma, the primitive ovary, that is during the development in intrauterine life, the ovary of the fetus, it differentiates into two main components. That is, whether it is the ovary or it is the testes, both of them are going to differentiate in two main cell lines, male directed cells and the female directed cells. The male directed cells, remember that this is the ovary, which is a female which is a female gonad, but even then it is going to contain certain male derived cells, or those cells which differentiate into the male directed cell lineages, and they are the Sertoli and the Leydig cells, which produce androgens. They are hormonally active, they produce androgens. And the female counterpart is the granulosa and the theca cells, those which differentiate, the ovarian stroma which differentiates along female sex lines, they are the granulosa. They are comprised mainly of the granulosa and the theca cells, and they secrete estrogen. The corresponding tumors from these two cell lines, male directed cells, they produce the masculinizing tumors, mainly the Leydig cell tumors. And those which differentiate along the female cell lines, they produce feminizing tumors like the granulosa and the theca cell tumor. अब इनमें granulosa cell tumor is very important. इसमें इम्तिहान में इसके ऊपर नोट भी आ जाता है granulosa cell tumor. Name the sex cord stromal tumors of the ovary and describe in detail the granulosa cell. So the granulosa cell tumors, as the name indicates, it resembles the granulosa cells of a developing ovarian follicle. As you all know, the ovarian follicle में the developing ovarian follicle में दो layers होती हैं. Inner layer is that of the granulosa cells, and the outer layer is the theca cells. So the granulosa cell tumors, they arise from the inner granulosa cell layer of the developing ovarian follicle. Now, based on the age of the patient, the morphological features and the mutational profile, the granulosa cell tumors are divided into two main categories. The adult granulosa cell tumors, which constitute 95% of the granulosa cell tumors, and the juvenile granulosa cell tumors, which constitute 5%. अब इसका ये मतलब नहीं है कि जो अडल्ट हैं वो अकर ही अडल्ट में करेंगे, बच्चों में नहीं अकर कर सकते, और ये मतलब नहीं है कि जो जुवेनाइल ग्रैन्युलोसा सेल ट्यूमर्स हैं वो सिर्फ बच्चों में अकर करेंगे, दे विल नॉट अकर इन एडल्ट्स। बस इनमें थोड़ी सी डिफरेंसेस हैं, वो मैं आपको बता दूंगी। एंड द अडल्ट ग्रैन्युलोसा सेल ट्यूमर्स, two-thirds of them, that is more than 75%, they occur in post-menopausal women. And they are hormone producing tumors. They produce estrogen. And the production of estrogen by these tumors is responsible for producing endometrial hyperplasia. It is also responsible for producing endometrial carcinoma, and it also produces hyperplasias of the female breast. It produces hyperplasia of the female breast because they produce large quantities of estrogen. So regarding the morphology, the granulosa cell tumors, they are unilateral. They range in size from small to large masses, and they may be both solid as well as cystic and capsulated. Those which are hormonally active, they have a yellow coloration. They are yellow because of the production of steroid hormones like estrogen. Steroid, जो भी hormones हैं हमारे, they are derived, they are steroidogenic hormones. तो जो भी इसका जो yellow होगा, yellow color अगर grossly नजर आ रहा है, तो you can guess that this tumor must be hormonally active. It must be producing estrogen. On microscopic examination, these tumors, they occur in the form of बड़ा सारे इनकी वेरिएबल पिक्चर होती है. They can occur in the form of cords, लंबी लंबी cords हैं, linear arrangement है, ribbon like patterns हैं, sheets हैं, strands हैं, groups हैं, clusters हैं. And the morphological hallmark which you can see in these cases is the presence of Karl Exner body. The Karl Exner body is a specialized type of structure which you can see, and it appears in the form of a gland, and that small gland and the center of the gland contains pink eosinophilic secretion, and that gland, it resembles an immature developing follicle. और जो granulosa cells होते हैं, जो granulosa cells of a granulosa cell tumor, they have elongated होते हैं, they have a longitudinal groove, और बिल्कुल ऐसे लगता है kidney shaped इनका nucleus होता है, kidney shaped nucleus with a central groove, and they are described as having a coffee bean appearance. The presence of nuclear grooves imparts a coffee bean appearance to these cells, और coffee beaning की वजह से बिल्कुल ऐसे लगता है जैसे kidney shaped. Or those tumors which elaborate large amounts of estrogen, they may appear plumper, and they are known as, we say that they are luteinized. They have more ample cytoplasm. वैसे इनमें इतना साइटोप्लाज्म नहीं होता जिस तरह हमारा डिस्जर्मिनोमा में बहुत ज्यादा एम्पल क्लियर साइटोप्लाज्म है, इसमें इतना साइटोप्लाज्म नहीं होता. सो मच सो दैट समटाइम्स दे रिजेंबल मैच्योर लिम्फोसाइट. छोटे छोटे सेल्स होते हैं, स्कैंटी अमाउंट ऑफ साइटोप्लाज्म. नाउ दिस इज अ फिगर. लेफ्ट में इज एन इयोसिन हेमाटोक्सिल. दीज आर द कार्ल एक्सनर बॉडीज. ये एक दो इसमें नजर आ रही, gland like structures, 3, and this is the pattern in which the tumor is ये ribbon like pattern है, groups and you can see that these cells, they have very scanty cytoplasm. They appear as small round blue cells, and on the right is an immunohistochemical stain, and the immunohistochemical stain is inhibin because physiologically speaking granulosa cells ka jo tumor product hai, that is inhibin. So this and that inhibin can be detected both in the serum as well as in the tissue के ऊपर हम कर सकते हैं इसको डिटेक्ट करने के लिए. And the adult granulosa cell tumors, इनके में जो म्यूटेशनल प्रोफाइल है, that is FOXL2 म्यूटेशनल प्रोफाइल. अब अडल्ट ग्रैन्युलोसा और जुवेनाइल ग्रैन्युलोसा में एक फर्क ये है कि जो कॉफी बीनिंग और जो न्यूक्लियर ग्रूव्स हैं वो जुवेनाइल ग्रैन्युलोसा सेल ट्यूमर में नहीं नजर आते. And the juvenile granulosa cell tumors, they carry a bad prognosis as compared to the adult granulosa cell tumors. And remember that all granulosa cell tumors are potentially malignant, but they behave in a low grade malignant fashion, and recurrences can occur, but these recurrences they occur after a long tumor free time interval. They can occur even after 10 to 20 years. So the clinical importance of these tumors is that because they are functionally active, they produce large amounts of estrogen in prepubertal girls, those girls who have not had their menses before the age of menarche. Prepubertal girls, they are they cause precocious sexual development, that is premature development of the breasts. And adult females of the reproductive age group, they are going to produce proliferative breast disease. Proliferative breast disease, endometrial hyperplasia, and endometrial carcinoma. This is the clinical importance of granulosa cell tumors. And endometrial carcinoma, concurrently, a female who has a granulosa cell tumor, अगर आप उसका endometrial cavity की भी examination करेंगे, 15 to 20% cases, about 15 to 20% cases are going to be associated with endometrial carcinoma. And these tumors, some granulosa cell tumors, they also produce the androgens, they produce testosterone, but they are rare. The granulosa cell tumors, they behave like low grade malignancies, but they have a very good prognosis. After removal, there is a 10-year survival rate of 85%. And the tumors which occur predominantly, composed predominantly of theca cells, are never malignant. The biomarker, the tumor marker of this tumor is inhibin, and it is characterized by having elevated tissue पर भी हम tissue पर भी inhibin levels कर सकते हैं, inhibin immunohistochemical stain कर सकते हैं, जो कि अभी मैंने आपको दिखाया था. A positive stain is going to appear as a brown coloration. This is the brown coloration of inhibin. Inhibin is a product of normal granulosa cells, and iske elevated levels go in favor of granulosa cell. Now, the importance of identifying serum levels of inhibin is that it is useful for identifying granulosa and other sex chromosomal tumors, and also monitoring the prognosis of patients who are being treated for these neoplasms. If after removal, the inhibin, serum inhibin level falls to normal levels, it means that the tumor has been completely excised. But if after removal, rising, the levels they start rising, it indicates that the tumor has recurred. And the mutational profile, I told you that it is FOXL2, and that is a transcription factor. The FOXL2 mutations are not seen in the juvenile granulosa cell tumors. The coffee bean appearance is also not seen in the juvenile granulosa cell tumors, and the juvenile granulosa cell tumors, they behave more aggressively as compared to the adult granulosa cell. The second category, which comes in the heading of the Sertoli lady, which comes under the heading of the sex cord stromal tumor, is the fibroma category. We have fibromas, we have thecomas, and then we have a combination of fibromas and thecomas, which are known as fibrothecomas. The thecomas and the fibromas, they are more or less similar, but thecomas are basically grossly, they are yellow in color because they are hormonally active. Thecoma और फाइब्रोमा में ये फर्क है कि जो थिकोमास हैं hormonally active होंगे, they produce steroid hormones, and therefore they are going to be yellow in color. They are going to be yellow in color, और इनके जो spindle cells हैं, because these are tumors which are derived from the ovarian stroma. Ovarian stroma बिल्कुल spindle shaped होता है, उसका feather stitched appearance. Those which are composed of plump spindle shaped cells, plump होंगे with clear lipid droplets in the cytoplasm, are going to be known as thicomas. They are going to be yellow and they are going to be hormonally active. Fibromas are going to be hard, but they are going to be white in color. वो yellow होंगे, fibromas white होंगे, they do not produce hormone. Fibrothecoma is a combination. अब एक MCQ जो फाइब्रोमास के रिलेशन में आता है is the Meeks syndrome. Meeks syndrome is because it is a syndrome, इसमें 3 clinical features होते हैं. इसमें right sided pleural effusion होती है, इसमें right sided pleural effusion हो जाती है और इसमें ovarian fibroma के साथ ये associated है. And an ovarian fibroma which is more than 6 centimeter in diameter. Or is right-sided pleural effusion and the presence of an ovarian fibroma. Achha, this is an ovarian fibroma. ये इसका spindle-shaped cells. This is the microscopic appearance of an ovarian fibroma. This is the gross appearance of an ovarian fibroma. ये जो ये side पे है, this is the fallopian. Clinical presentation is pelvic mass with pain, and the fibroma is associated with Meeks syndrome, which is a combination of ovarian fibroma, right-sided pleural effusion, which is known as hydrothorax, and ascites. Ascites occurs in those tumors which measure more than 6 centimeter in diameter. And the right-sided, it is usually on the right side and the genesis is not known. And number 2 syndrome, which is associated with ovarian fibroma, is the basal cell nevus syndrome. The basal cell nevus syndrome, it is an autosomal dominant disorder and it is characterized by multiple basal cell carcinomas in young life. बच्चों में basal cell carcinomas plus medulloblastomas, which are tumors of the brain, as well as certain keratocysts of the palms and soles. अब आ जाते हैं हमारे पास the Sertoli Leydig cell tumor. ये हम कैटेगरीज कर रहे हैं सेक्स कॉर्ड स्ट्रोमल ट्यूमर की. इसमें हमने ग्रैनुलोसा सेल ट्यूमर कर लिया है, अडल्ट एंड जुवेनाइल, फाइब्रोमा कर लिया है, थिकोमा कर लिया है, and a combination of fibromas and thicomas known as fibrosis. अब आ जाती है the category of the Sertoli Leydig cell tumors. The Sertoli Leydig cell tumors are those tumors which arise in the ovary, but they differentiated according to male sex lines. They have differentiated along the male directed cell lines, and they occur in females of all ages, but in the younger age group, and they are usually functional. They are associated with the production of masculinizing or defeminizing hormones, and because of the production of masculinizing or androgen producing hormones, these tumors are characterized by causing atrophy of the female breast, amenorrhea, sterility, loss of hair, and then hirsutism and thick voice, striking virilization, that is hirsutism with male distribution of hair and a thick voice like a male voice and enlargement of the clitoris. These are all masculinizing features which are produced because of the excessive production of androgens. Now this is a Sertoli cell tumor gross. ये येलो आपको नजर आ रहा है because of the production of steroid hormones, and these are the tubule-like structures of the Sertoli cells. These are the Sertoli tubules. ये tubules and these are the Sertoli tubules. Other sex cord tumors ये आपको करने की जरूरत नहीं है. Gonadoblastoma याद रखो. Gonadoblastoma is an ovarian tumor which is a combination of It is a combination of germ cell tumor and sex cord stone. यानी कि जो हमारी सेकेंड एंड थर्ड कैटेगरी ऑफ द ओवेरियन ट्यूमर्स है वो दोनों मिक्स हो गए हैं. So that is gonadoblastomas, and gonadoblastomas usually occur in females जिनका जो characteristics pseudohermaphrodites, you can say that their sex characteristics are not well defined. They are intersex females. They are, you do not know whether they are females or they are males. Intersex gonadal dysgenesis. Then we have the fourth category, which is a very important category. ये मैंने आप लोगों को पहले भी बता दी कि these are the metastatic tumors to the ovary. Now, metastatic tumors to the ovary can be classified into two. Those tumors which are of Mullerian. Mets can occur to the ovary from tumors of Mullerian origin, like carcinoma of the uterus, carcinoma of the fallopian tube, carcinoma of the contralateral ovary, or pelvic peritoneum can produce their metastatic deposits to the ovary. So those are known as the tumors of Mullerian origin. Then we have certain tumors of extramullerian origin, which can also produce their metastatic deposits to the ovary, like carcinoma of the breast, carcinoma of the gut, colon, stomach, pancreas, appendix. They can produce their metastatic deposits to the ovary. Now, remember कि जितने भी हमारे metastatic tumors to the ovary होंगे, from some other side, they are usually going to be bilateral. They are going to be bilateral. Now, pseudomyxoma peritoni हमने कल पढ़ा था. It is a clinical syndrome and it is characterized by the presence of mucinous type of ascites. इसमें the whole of the abdominal cavity is filled with a glary type of sticky jelly-like mucin. It is a clinical term and it is usually due to carcinomas or malignant tumors of the appendix. Historically, it was said that these tumors, pseudomyxoma peritoni, has been produced due to a malignant ovarian tumor, but that theory has been abandoned. Although it still holds validity, but only for a small percentage of ovarian tumors. The vast majority of tumors which produce pseudomyxoma peritoni are of appendiceal origin. Now, Krukenberg tumor is very, very important. Viva में भी पूछा जाता है, SCQs में भी पूछा जाता है, MCQs में भी पूछा जाता है. It is a bilateral metastatic tumor to the ovary from a gastrointestinal primary, and that gastrointestinal primary is usually from the stomach, composed of mucin producing signet ring cells, most commonly from the stomach. Now, this is a Krukenberg tumor. ये सेंटर में आपको यूट्रस नजर आ रहा है, and on both sides you have bilateral large tumors, and these are Krukenberg tumors. On histological examination, they are composed of mucin producing signet ring cell. Now, this is a microscopic examination showing the signet ring cells. The nucleus has been pushed towards the periphery, and the center is occupied by a mucin rich vacuole. This is one figure and this is another figure. And these usually occur from primary gastric tumors. Gastric tumors of the Lauren classification में जो signet ring cells आ जाते हैं, which are associated with E-cadherin mutation, they produce their metastatic bilateral deposits to the ovary. Thank you. नहीं, अब तो टाइम नहीं खत्म हो गया, 9:30 हो गए. 10 मिनट है तो स्टार्ट कर दो. Now we are going to start with the male genital system. We still have 10 minutes. And in the male genital system, we are going to start with the testes and the prostate. हम ये दो मेन चीजें डिटेल में करेंगे. Now, आपको इसकी anatomy and histology तो पता है. This is the testes, and we have two testes, paired organ. Both the testes, they are located in the scrotal sac, and they are suspended in the scrotum with the help of the spermatic cord. This is the cut section of one testicle, which is suspended by the spermatic cord. This is the histology of the test. This is a, ये तो आप लोगों को सारी histology पता है. This is the seminiferous tubule. This is the seminiferous tubule. This is the basement membrane. This is one complete seminiferous tubule. These are cut sections of other seminiferous tubules. And the seminiferous tubule में ये जितने भी हैं cells, these are the germ cells, and they mature from the periphery towards the center. Center की तरफ जाते जाते हैं तो यहाँ पे होते हैं हमारे germ cells, which are the immature germ cells. Then they start maturing, और जो center में आ जाते हैं, they are the spermatids and the spermatozoa. Luminal aspect पे जो lumen की तरफ होते हैं, they are the smaller cells, flagellated spermatids and the spermatozoa. यहाँ पे उनकी different phases of maturation होती हैं. Germ cells, primary spermatogonium, the secondary spermatogonium, then we have the spermatids, and then we have the flagellated mature spermatozoa. This is another diagram showing the maturation of the spermatocytes from the periphery towards the center. This is the basement membrane of the seminiferous tubule. These are the Sertoli cells. Sertoli cells are the supporting cells. They're just majority of cells which occur in this cell layer are the germ cells. They are the germ cells, and the Sertoli cells, हर 3-4 germ cell के बाद we have a columnar Sertoli cell, which are the supporting cells. Center में आप देखो कि we have the tails in the lumen. These are the sperms, mature sperms. These are the spermatids and these are the sperms. This is the testes, cut section of the testes, and the testes contains numerous seminiferous tubules, and this is the epididymis. This is another cross section of a seminiferous tubule. ये अंदर आपको sperms के flagella नजर आ रहे हैं. This is the basement membrane. This is the germ cell, germinal cell, which is diploid. And then we have the primary spermatocyte, which is again diploid. Then we have the secondary spermatocyte, which is produced as a result of meiosis, and this is haploid. And then we have the spermatids, which are also haploid. They develop after the second meiotic division. Now, coming on to the congenital anomalies. अब ये वाइवा में भी पूछा जाता है, और अब एग्जाम्स में congenital anomalies पे बहुत emphasis दे रही है. जो UHS की तरफ से जो पेपर बनता है उसमें congenital anomalies, GIT में भी congenital anomalies पे बहुत emphasis है, और testes में भी congenital anomalies. तो when one very important congenital anomaly is the crypt orchidism. Crypt orchidism means undescended testes. It is a complete or partial failure of the intra-abdominal testes to descend into the scrotal sac. Now, during embryonic life, the testes is present in the abdominal cavity, and it then, during the development of the child, during intrauterine life, the testes, it migrates downwards. It migrates downwards, and then it has to descend to its anatomical location within the scrotal sac. And a testis which has not descended into the scrotal sac is known as crypt orchidism, and it is associated with testicular dysfunction. And ये इसलिए बता रही हूँ कि हमने testicular tumors करने, तो you should know one very important predisposing factor, that an undescended testes is a very important predisposing factor for testicular cancer. And it is present regarding its frequency. It is present in 1% of 1-year-old boys. And it may either occur as an isolated anomaly or it may occur with other abnormalities of the genitourinary tract. Other congenital anomalies means absence of one or both testes, or there is fusion of both the testes, which is known as synorchism. There are two phases of the physiological phases of testicular descent. There is the transabdominal phase in which the testes comes to lie within the lower abdomen or on the brim of the pelvis. And this phase is under the control of a hormone called the Mullerian inhibiting substance. And arrest at the transabdominal phase, arrest at this phase accounts for only 5 to 10% of the cases. Then there is the second phase of descent of the testes, which is the inguinoscrotal phase. And in this phase, the testis comes to lie, it descends through the inguinal canal and it has to descend into its normal location into the scrotal sac. And this phase is under the influence of androgens. And these androgens are derived from the genitofemoral nerve. So there are two phases, and the majority of cases of cryptorchidism are due to an arrest at this phase, which is the inguinoscrotal phase. Cryptorchidism could be unilateral and it could also be bilateral. यानी कि एक टेस्टिस अपनी पोजीशन में आ गई है, दूसरी नहीं आई, और it could be bilateral. It could be unilateral or bilateral. And histologically, because it is not present in its normal location, it is going to be abnormal. And changes, histological changes are going to appear early. There is going to be marked hyalinization and thickening of the basement membrane. वो जो हम seminiferous tubules की जो outline कर रहे थे, that is the basement membrane. In a crypt orchid testes or an undescended testes, there is going to be marked hyalinization of that testes. ठीक है? Of that basement membrane. In the later stages, the tubules की बिल्कुल atrophy हो जाती है, उनके अंदर germ cells खत्म हो जाते हैं, and the tubules they appear as hyalinized thick cords of tissue. There is और सिर्फ आपको prominent basement membranes और hyalinized tubules नजर आ जाती हैं, कोई cell नहीं अंदर आ. There is an increase in the interstitial stroma and जो seminiferous tubules के बाहर जो tissue होता है, that is composed of pink eosinophilic cells which are known as the Leydig cells. But the Leydig cells are spared in a crypt orchid testis. So grossly, a crypt orchid testis is going to be small in size. It is going to be firm in consistency because of excessive amount of fibrosis. We'll continue from here tomorrow, inshallah. Thank you.